GLP-1 medications have been all the rage for the past few years, and for good reason. They've been the most effective medications so far in not only treating obesity, but improving other serious medical conditions as well. Hi, I'm Dr. Esra Shermadou. I'm a board-certified family medicine and obesity medicine physician. Last week, we discussed non-GLP-1 anti-obesity medications. So if you missed that video, make sure that you go back and check it out. Today, we're focusing on GLP-1 and GIP, GLP-1 injectable medications, and how they've been life-changing for many people. It's a known fact that obesity rates are rising worldwide. Right now, about 1 in 3 adults is living with obesity, and these numbers are only going up. Obesity is linked to serious health conditions like diabetes, heart disease, several cancers, joint pain, and many other chronic illnesses. But here's the hopeful part. Losing 5 to 15% of body weight can improve many of these conditions. The challenge is that obesity is multifactorial, and it's not just about eating less and moving more. For many, losing weight, and especially keeping it off, is incredibly difficult, and it's not all about willpower. After weight loss, the body undergoes real physiological changes that make regaining weight more likely. This is where anti-obesity medications, especially the GLP-1 receptor agonists and the newer agents, have been game-changing. Now, weight loss isn't just about taking medications. It's much bigger than that. Lifestyle foundations like nutrition, movement, sleep, and stress management always matter. But biology often pushes back. Hormones shift, appetite increases, metabolism slows, and the body defends its higher weight despite your best efforts. This is where medications like the GLP-1s can make a difference. GLP-1 stands for glucagon-like peptide 1. It's a hormone that your gut releases after meals that acts on several systems, including your pancreas, your gut, and your brain. GLP-1 helps the pancreas release insulin when sugar is high, slows down how quickly food leaves your stomach, and signals the brain that you're full. We all make GLP-1 naturally, but in some people, the hormone breaks down quickly, which limits its effect on satiety. GLP-1 receptor agonist medications are designed to mimic this hormone, but it lasts longer in the body. This means that their beneficial effects like appetite control will stick around longer, leading to real weight loss. Now let's talk about some of the more well-known medications. Let's start with Liraglutide, the oldest GLP-1 medication. It was approved by the FDA in 2010 for diabetes under the name Victoza. In 2014, it gained approval for obesity treatment under the name Sakinah. It's a daily injection and helps people lose about 5 to 7% of their body weight. Like other GLP-1s, Liraglutide stimulates insulin release, slows digestion, and improves satiety. Recently, at the end of August of 2025, the FDA approved a generic version of Liraglutide to be used for weight loss. While it may not be as effective as some of the newer and other injectable medications, becoming generic may allow it to become accessible to those who otherwise could not afford GLP-1 medications. So it'll be interesting to see the effects of this over time. Common side effects of Liraglutide include GI issues like nausea, vomiting, diarrhea, constipation, or indigestion. More rarely, it can cause pancreatitis or gallstones. In 2021, Semaglutide was approved for chronic weight management. It's better known as Ozempic when used to treat diabetes, and Wegovy when used to treat obesity. With once-weekly dosing and stronger weight loss effects, it quickly became more popular. On average, patients lose about 15% of their body weight, results that made global headlines because they were previously only possible with surgery. Semaglutide shares similar side effects like Liraglutide, with GI symptoms like nausea, vomiting, constipation, as well as gallstones and pancreatitis. Importantly, both Liraglutide and Semaglutide have been shown to reduce cardiovascular risk in people with diabetes, and Semaglutide has been shown to slow the progression of chronic kidney disease in this population as well. Now let's talk about the next generation, Tirzepatide, sold as Mounjaro when used to treat diabetes and Zepbound when used for chronic weight management. Tirzepatide activates 2 receptors, GLP-1 and GIP, so it can treat obesity in 2 ways. GLP-1 reduces appetite, slows digestion, and improves insulin release. GIP further enhances insulin secretion and improves fat metabolism. Together, this creates a powerful synergy, Clinical trials average weight loss of up to 20% of body weight, making tirzepatide one of the most effective anti-obesity medications we've ever seen. Many more drugs are in study for weight management, including injectables and pills. Retatrutide is the next big injectable currently being studied. It activates 3 receptors: GLP-1, GIP, and glucagon. What role does the activation of glucagon receptors have? Preclinical data shows that it improves lipolysis, or the breakdown of fat, and increases basal metabolic rate, which translates to enhanced weight loss and increased energy expenditure, and potentially also improving triglyceride levels and your LDL cholesterol. In early studies, retatrutide produced weight loss approaching 25% or more of total body weight, results that begin to rival bariatric surgery. So, to recap the medications we've covered in this video, we have Liraglutide, which is a daily injection with modest weight loss of 5 to 7%. Semaglutide, weekly injection, strong results around 15% weight loss. Tirzepatide, which is the dual GIP and GLP-1 receptor agonist, showing about 20% reduction. And retatrutide hits 3 receptors and seems to be the most powerful yet. Of course, all these medications come with potential side effects, most commonly nausea, vomiting, diarrhea, and constipation. Cost and access can be real barriers. And remember, these medications are tools, not magic. The best results always come when we pair them with nutrition, movement, sleep, and long-term lifestyle support. Obesity is not a failure of willpower. It's a chronic medical condition, and now we have effective medications that can help people make meaningful, lasting changes. But medications are just one part of the bigger picture. Resistance training, nutrition, and lifestyle shifts are essential, not just during treatment, but long after as well. This can feel overwhelming to navigate alone, but you don't have to. If you're looking for support, make sure that you visit SakinahHealth.com to learn how I can help. Be sure to also join our priority list so you're the first to know when we begin to accept patients. And if you found this helpful, make sure that you subscribe for more breakdown on health and hormones, and share this with someone who's curious about these medications. Thanks for watching, and we'll see you next week.